Thank you so much, Peter, for the wonderful introduction to food environments and also systems research within this context. Um, can I ask you to be my slide master? Perfect. So what we are working on, as Peter already explained within the FooDSAMSA project, this specific work package was focused on using this complex systems analysis or system dynamics. And specifically, we were interested in using group model building with a range of stakeholders in the Cape Town metro area to develop complex systems maps, which showed the drivers, outcomes, and levers or leverage points of the double burden of malnutrition. And as Peter mentioned, we were doing this at different socio-ecological levels. So we were interested here in the context of micro as an individual and household, and then at the meso level, which encompassed more of the community level, local policy structures. All right, so we had a three-stage process. In the first one, we conducted individual interviews with stakeholders from both of these levels, and then we analyzed these to develop our sort of codes for qualitative research. And then in the second phase, we used these codes to develop what's called an interrelationship diagram. So I'll show you what that looks like, as well as our seed model, which we then used in the final step, which was these group model building workshops, which we held separately with our two different groups of stakeholders. So in the first phase, at the micro level, we ended up with 21 interviews, and this was with community health workers and their coordinators from 3 different townships that you can see listed there. And these interviews were conducted in the winter, spring, or in the summertime in South Africa, but yeah, in English and Xhosa. And then at the meso level, we had 14 interviews, and this was primarily with researchers working in nutrition and food security or urban design, but also employees of the local government for the city of Cape Town and the provincial government of the Western Cape. And then we also worked with civil society and community health worker administrators, so more at the programmatic level, as opposed to the community health workers themselves. So what we did after we had these interviews, as I said, we analyzed them, and then we came together actually as a team to do sort of this group coding, where we condensed our findings from the interviews into the major themes, and we drew what's called an interrelationship diagram. So the images you see on the right are showing how we did this by hand, which is basically taking your main variables and outlining them in a circle and then drawing the relationships and saying this variable is directly influenced by variable B. So then on the next slide, I'll show you what this looks like when it was finalized on a computer. So you can go to the next one, Peter. Perfect. So that was by hand, and then this is what it looks like when you transfer it to a software called FEREN. And you can see in this that those variables which have the most incoming arrows, so where all the blue is going towards, those are your primary outcomes. So those are being the most influenced by your other variables. Yeah, so as Peter is showing you, these are the variables clustered at the top, versus those variables that have the most outgoing arrows are the primary drivers. They are having the greatest influence on the most number of other outcome variables. So that's the interrelationship diagram, which we then took as a team and created what's called a seed model, which is basically just the starting point for the causal loop diagram that you're going to build with the group. So in this case, as a team, we decided to work with food security as our primary outcome based on what we saw in the interrelationship diagram. And then we picked just a few other variables that it was already connected to and started to draw those relationships and the polarity, which is those plus and minus signs that you see. So then at the meso level, we went through a very similar process. We also read through our interviews in a group coding session. You can click forward, Peter, a little bit. There we go, perfect. So this consisted of team members, I think I forgot to say this for the micro level, but from both the German partners and our South African partners. And then again, we condensed this into themes. And then over an iterative process, we then developed this into the interrelationship diagram and the seed model again. And you'll see on the next slide that our IRD, our diagram, was even more complex the second time around. The meso-level stakeholders had a lot of variables that they named. And you'll see as we proceed to the causal loop diagram that sort of the reason for this is because the meso-level was also encompassing, like we said, that local policy level, but also down to the more micro-level variables, the community and individual determinants as well. So that's kind of why this one encompassed, you'll see similar variables that you saw from the micro level. So if we go to the next slide, then our third phase, as I mentioned, was the group model building workshops. At the micro level, thankfully, we got to do this in person over the course of 2 days. If you click forward a little bit, Peter. Perfect. So we had 13 community health workers and coordinators and one Western Cape wellness volunteer who were able to participate. And we used a variety of scripts, which for those not familiar with system dynamics, scripts are basically sort of mental exercises that you walk through together as a group to deeper understand your issue, really. And so these were adapted from Scriptopedia, which is an online repository for these system dynamic scripts. So one of them we used was Rich Pictures, which you can see on the right. We also had variable refinement, where we asked the participants, because as you saw, we as researchers coded these interviews and came up with these variables. So we wanted to take them back to the stakeholders and say, did we get this right? What are we missing? What do you think of this? And then we also used graphs over time and several other scripts. And in the end, we came up, we kind of split into teams, and we had 3 different groups that came up with their causal loop diagrams based on that seed model that I showed you earlier. So having food security as that primary outcome, you can see that's in the center of all 3 of these causal loop diagrams. And then they use the other variables to create their own causal loop diagram. And then as a research team, we came and we put all of these together on the second day of the workshop and brought it back to the stakeholders, and this is what we came up with. So we have this very colorful diagram. I know it's a little small, so I'll walk you through a little bit of it, but basically we had 6 different pathways or clusters that we identified. That's the different color coding. So we had those variables that were most related to income, so things like social grants, debts, and employment. We also had those that were based on relationships, so relationships with community health workers, but also with informal businesses. We had just one that we really linked to behavior, which was our main, interest of changing behavior was on the consumption of healthy food. And then we had resources, both at an individual level, but also within the community. So this includes personal gardens, but also community gardens, budget skills, access to cooking resources like electricity or a stove. And then we also had barriers to food security, which were things, there's just 3 of them. So this was alcohol and drugs, and then crime, which the participants identified as being really just barriers to good nutrition. And then the last one is other sort of food environment, larger food environment determinants. So things like food safety and quality, and the availability of food, and then our primary outcome, which was food security. So then moving on to show the meso level, we also had a workshop for these stakeholders. We had 8 participants, and due to time constraints of these stakeholders, we had this online. So the image you see on the right is what this looked like. It was adapted from another system dynamics study by Wilkerson et al. And it was using Miro board to walk through these scripts as well. So if you skip forward one, Peter. So you'll see we had, again, these similar scripts, but just a shorter number because this was only a half-day online workshop. So we really had to adapt from a 2-day workshop. So the next one, yeah, perfect. So what happened between these 2 images you just saw of the Miro board and this sort of messy looking causal loop diagram was that due to the limited time constraints, we had an initial causal loop diagram that the participants, the stakeholders worked on during the workshop based on the previous seed model, but we didn't get all the way done with building the connections between the variables and identifying the feedback loops and the clusters. So we as a team then met progressively over the next few months. Actually, it took a long time to discuss further relationships and sort of further refine the variables that the stakeholders had identified. And now we're currently in the process of going back to the stakeholders with this map and asking for their feedback. And again, saying, did we understand you correctly? Are there linkages that are missing? What do you think of these clusters that we've identified? Does that align with your experience and what you think came out of the group model building workshop? So in this one, you'll see that we have, oh, sorry, Peter, can you go back real quick? Thank you. Sorry, just one more thing. So you'll see that we have 7 different groupings or clusters that we've identified. So commercial determinants of health was something that really came out strongly as being a driver at the meso level for the double burden of malnutrition. And then we had those that had to do with social and equity awareness, so things like gender sensitivity, social and environmental vulnerability. We also had all of these policy related drivers. So because this was the meso level, as I mentioned, you'll see sort of this top half of the map is more of those meso level referring to policy action and governance. And then the bottom half, you'll see a lot of those same variables that you saw in the micro level. So things like income, employment, access to land for gardening, food and nutrition literacy. And these are all basically repeated from the micro level because there is this acknowledgement that obviously it's an interplay between the meso level policy variables and individual action, right? Or individual determinants. And yeah, the more micro level drivers. So we have this overlap between the two maps. So you'll see in the light blue, this access to resources. Those are very similar to what you saw at the micro level. And then the food security focus is this purple. So that's kind of our broader variables about a government priority on food security. And then we have governance principles. And lastly, this personal and external food environment. So related to what Peter showed at the beginning, that graphic about these different elements of the food environment. So this is the factors that relate most to that. And as you can see from this little sign, this is, as I mentioned, still a work in progress. So we're taking it back to the stakeholders, and then we'll also still have to develop those intervention points at the meso level, which we haven't done yet. Now you can move forward. Perfect. Thanks, Peter. So I want to talk a little bit about some of the limitations of this work and some of the challenges. So in regard to the process, if you're familiar with system dynamics and group model building, when you do this kind of participatory work, it's advisable that you have someone who works as a sort of gatekeeper. So someone from the community who is, involved and aware of the problem that you're trying to address, that you're trying to model. And we attempted to have this, someone who could work with you through the whole process. So from the development, through the analysis, through the workshops, and also kind of acts as, your liaison with the community. Unfortunately, for various reasons, this did not come to fruition for our project. So definitely in the future, it would be great to have someone who acts more as this gatekeeper throughout the whole process instead of just sort of piecemeal, which is more what we had. And then also a big challenge, as I mentioned before, was the time constraints. So particularly with the meso level stakeholders, they have very tight schedules, and it was really hard to have these longer workshops. So that's why we only had this 4-hour workshop initially. And then in regard to the outcomes, we also had challenges to identify leverage points. So at the micro level, this was also, again, due to the time. So we did identify some leverage points during the 2-day workshop, but it was in the second day, and there just wasn't as much time dedicated to it as we would have liked. So that's something that we're going to be returning to. And then at the meso level, also due to time, we didn't really have a lot of time to get into these intervention points during that first workshop. So we're holding a second workshop where we just talk about leverage points. But it's also brought up that identifying these policy levels, policy level intervention points is also really challenging due to sort of the context of policymaking in this, what you may have heard of before as like a VOCA world, so this volatile, uncertain, chaotic, and ambiguous landscape of policymaking, which has a lot of factors that come into that, like power dynamics, conflicts of interest, different shifting administrations make policy interventions, quite challenging. So these are some of the things that we are talking about as a team and identifying as challenges to our work. But now I will pass back to Peter to wrap us up with these last points.
Thanks, Nikki. That was very concise, to the point. We also spotted some, we noted down, if you want, some observations from a user perspective. That was actually communicated also probably mostly by our colleagues who operate at policy level. So it's very much trying to identify those spaces where we can translate what we found, so the evidence, into actionable recommendations. So policy decision making, so what is called evidence-informed decision making landscape, right? So, and that is why we are trying to find potential building blocks for building advocacy coalitions, if you want. Which spaces can we work based upon what we found at the local grassroots micro level, and how is that malleable, or how can we use that at a higher level, if you want, at meso level, to influence policymakers. And it is always, it's quite important to identify one or more political champions, because policymaking is essentially is a political process. Of course, it's a messy process. So you need to influence people. It's always about personal relationships. So you can do that in a structured way. You can do it very much in an ad hoc way. It is based on those sorts of relationships of trusts and credibility that you have built over the years, or maybe new champions that you can identify, people who really champion the cause and are in favor. Those are the ones who will be driving your agenda. So it is important to have that sort of IKT strategy in place. IKT meaning integrated knowledge translation, in order to be able to translate your findings. But that may obviously be hampered, if you want, by if there is no such person available, or if there is too many other conflicts of interest, as Nikki said, if there is no space for communication. A good place we found, for example, for communicating or talking about this is community in Dalbas, is using a structure that was put in place by colleagues of ours at the University of the Western Cape, in which food policy and especially local governance of food systems is being discussed with a broad group of stakeholders, including civil society, researchers, but also policymakers and people who are driving innovation agendas at policy level. So this then sort of creates that culture that we need, which is called the culture of knowledge co-creation, in order to come to shared responsibility. In health promotion language, it's always about the shared ownership and the shared vision, if you want, which will lead to more local ownership. And this is basically what we need. So we need to have the buy-in from the end user, the consumers, the people who live in the system, and then the people who decide on the levers in the system. And I think that's more or less what we wanted to say about that. So it is a little bit of complexity jargon mixed with the food environment, the research, but I think it's a very good example of how we applied systems thinking in trying to unpack the different elements and components of the system at grassroots level. This is hence one of the parts of the project that we've been talking about. And I think that's all for me or for us. These are the references. You're obviously free to contact us at any point in time. And I